Erectile dysfunction, ED, also known as impotence, is a common condition that affects many men worldwide. It is characterized by the inability to achieve or maintain an erection sufficient for sexual intercourse. While there are various factors that contribute to ED, including psychological and physiological causes, the role of nutrition and vitamins should not be overlooked. A healthy diet that includes specific vitamins and foods can play a crucial role in managing and even improving erectile function. Causes of erectile dysfunction. Physical factors. Conditions such as diabetes, cardiovascular diseases, obesity, high blood pressure, hormonal imbalances, and neurological disorders can contribute to erectile dysfunction. Psychological factors. Stress, anxiety, depression, relationship problems, and performance anxiety can impact sexual function. Lifestyle factors. Smoking, excessive alcohol consumption, drug abuse, and a sedentary lifestyle can increase the risk of erectile dysfunction. Treatment options. Lifestyle changes. Making healthy lifestyle choices can significantly improve erectile function. This includes regular exercise, maintaining a healthy weight, quitting smoking, limiting alcohol consumption, and managing stress. Counseling or therapy. If psychological factors are contributing to erectile dysfunction, therapy or counseling can help address underlying issues and improve sexual confidence. Medications. Several oral medications, such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are available to treat erectile dysfunction. These medications work by increasing blood flow to the penis, facilitating an erection. However, they should be used under medical supervision. Vacuum erection devices. These devices create a vacuum around the penis, drawing blood into the organ and helping maintain an erection. They can be used in conjunction with other treatments. Penile implants or surgery. In severe cases where other treatments have been ineffective, penile implants or surgery may be recommended to restore erectile function. In this article, we will explore 12 essential vitamins and foods that have been shown to be beneficial for erectile dysfunction. Vitamin D. Vitamin D is an important nutrient that plays a vital role in overall health. Recent studies have suggested a link between vitamin D deficiency and erectile dysfunction. Sun exposure, fortified foods, and supplements can help increase vitamin D levels, promoting better erectile function. Vitamin C. Vitamin C is an antioxidant that supports blood vessel health and improves circulation. It aids in the production of nitric oxide, a compound essential for achieving and maintaining an erection. Citrus fruits, berries, and vegetables like bell peppers are excellent sources of vitamin C. Vitamin E. Vitamin E is a powerful antioxidant that helps protect cells from oxidative stress. It promotes healthy blood flow by preventing the formation of blood clots and improving arterial function. Nuts, seeds, spinach, and avocado are rich sources of vitamin E. B vitamins. The B vitamins, including B1, B3, B6, and B12, are crucial for overall sexual health. They help support nerve function, hormone production, and energy metabolism, all of which contribute to proper erectile function. Whole grains, meat, fish, and legumes are excellent sources of B vitamins. Zinc. Zinc is an essential mineral involved in many bodily functions, including testosterone production and sperm quality. Low levels of zinc have been linked to erectile dysfunction. Oysters, beef, pumpkin seeds, and lentils are great sources of zinc. L-arginine. L-arginine is an amino acid that serves as a precursor to nitric oxide, which helps relax blood vessels and improve blood flow. This, in turn, can enhance erectile function. Sources of L-arginine include meat, poultry, fish, and dairy products. Pomegranate. Pomegranate is a fruit rich in antioxidants and polyphenols. It has been shown to improve erectile function by enhancing blood flow, reducing oxidative stress, and promoting nitric oxide production. Watermelon. Watermelon contains citrulline, an amino acid that increases nitric oxide levels, helping to relax blood vessels and improve blood flow. This natural Viagra-like effect can aid in achieving and maintaining erections. Dark chocolate. Dark chocolate is rich in flavonoids, which are potent antioxidants. These compounds improve blood flow, reduce inflammation, and promote cardiovascular health, all of which can positively impact erectile function. Garlic. Garlic contains allicin, a compound that enhances blood flow by relaxing blood vessels. It also has antioxidant properties that can help combat oxidative stress and promote overall vascular health. Fatty fish. Fatty fish such as salmon, mackerel, and sardines are excellent sources of omega-3 fatty acids. These healthy fats improve blood flow, reduce inflammation, and support cardiovascular health, all of which are essential for erectile function. Green leafy vegetables. Green leafy vegetables like spinach, kale, and Swiss chard are packed with vitamins, minerals, and antioxidants. They promote healthy blood flow, reduce inflammation, and support cardiovascular health, all of which are crucial for optimal erectile function. Conclusion. While there are various causes and treatments for erectile dysfunction, incorporating the right vitamins and foods into your diet can have a positive impact on your sexual health. The 12 essential vitamins and foods discussed in this article can help improve blood flow, support hormonal balance, reduce oxidative stress, and promote overall cardiovascular health. However, it's important to note that these dietary recommendations are not a substitute for professional medical advice. If you're experiencing persistent or severe erectile dysfunction, it's essential to consult with a healthcare provider to identify and address the underlying causes. By adopting a healthy lifestyle, including a balanced diet rich in these beneficial vitamins and foods, you can potentially enhance your sexual health and overall well-being. Remember to prioritize a holistic approach that encompasses exercise, stress management, and regular medical checkups to optimize your sexual function and maintain a healthy life. It is worth noting that while certain vitamins and foods may support overall sexual health, they should not be considered a cure for erectile dysfunction. However, maintaining a balanced diet that includes essential nutrients and vitamins can contribute to overall well-being, including sexual function. Consulting a healthcare professional is essential for a proper diagnosis and personalized treatment plan. They can evaluate the underlying causes of erectile dysfunction and provide appropriate guidance.